is the shoulder joint. Okay, this is a bone, but all these labels are muscles, and here are the rotator cuff. If you want to understand how the rotator cuff works, it's called a cuff because it attaches around the humeral head to create a cuff for maximum stability for this vulnerable joint. So when the shoulder moves in 360, like all the way up, all the way down, to the side, can rotate, so we can do all kinds of athletic movements. The shoulder is vulnerable for that reason, and then the rotator cuff injury is very common. So one of the common injuries that we see and we diagnose we diagnose it with ultrasound diagnostic. So no need for an MRI to do this because it is very simple. We place a probe on the targeted tendon and we ask the patient to rotate, for example, the shoulder in and out, and we're able to create a live image of the shoulder joint and the rotator cuff. Another thing, like some people have pain above 90 degrees movement. So if you go above 90-degree elevation, you start having pain. So look what happens here in this model. There is a narrowing of the space between here and the humeral head. So every time you move the shoulder this way, if any inflammation in the bursa or one of the tendons that goes under here, then immediately it can cause pain and dysfunction. So we also do the same thing here. We use the ultrasound placed right here, and we ask the patient to move the shoulder up and down. I want to talk about a testimonial that one patient left for us. I wanted to write a review, but I don't have a Google account. So Hisham performed an MSK ultrasound to diagnose shoulder problem. I found him to be very professional, knowledgeable, and a good listener with excellent communication skills. His congenial demeanor made the process easier. Not only was he able to assess the problem, he also provided me with a variety of exercises to help improve my problem. It's about how people can benefit from the value of diagnostic tool like ultrasound. When patients have implants and they cannot afford to go into an MRI machine, which can affect their health. Affordability, no need to spend so much money to get a diagnostic MRI. View of the moving tissue, like a dynamic scan. And we can record that and we can keep it on file and we can keep track of it and we can analyze it as well.